On behalf of our team at RDIC, we would like to welcome Joy Beidel. She is here this afternoon to discuss the type of work she does, the training she receives, the characteristics that they're looking for in candidates like herself, the career opportunities, salary expectations, and her working conditions. Just a reminder before we begin that after you watch this presentation, please complete the survey found on our website either by using the QR code or going to our website at www.rdic.ca. By completing this survey, you're automatically entered to win a $50 gift card, which will be drawn for at the end of every month. Thanks again to Joy for this informative presentation to help students in their quest to make a better choice about their future employment opportunities. Take it away, Joy.
Hi, everybody. Thank you for this opportunity for me to come on and tell you a little bit about what my journey has been and my career as a nurse practitioner. It isn't a very well-known profession from what I have encountered in my career, but I'm hoping to shed some light on that for everybody, just so that maybe I can promote. I'm a huge advocate for nursing and the nurse practitioner career. So I hope that you'll enjoy this presentation and learn a little bit more about what I do. So like was said previously, my name is Joy Beidel and I'm a registered nurse practitioner, and I'm going to tell you a little bit more about it. So first and foremost, what is a nurse practitioner? That's kind of the meat and potatoes of what we're going to get into here. So a nurse practitioner is a registered nurse who has additional education and nursing experience that enables them to diagnose and treat illnesses, order, interpret tests, prescribe medications, perform medical procedures. And we're healthcare professionals who treat a person as a whole. So what that means, holistic health takes into consideration not only physical health, but also includes emotional, mental, and spiritual health. So when we look at a person, we look at them as a whole. It's not just what brought you into the clinic today, but what has contributed to those health concerns. So this approach includes addressing needs related to a person's physical and mental health, gathering medical history, focusing on how an illness affects a person's life and their family, offering ways for a person to lead a healthy life, and teaching people how to manage chronic illness. So just a bit of history on this. Nurse practitioners were first introduced or appeared in Canada in the 1960s. In the early 70s, the career has taken more motion and numbers had increased, but originally nurse practitioners were introduced into the healthcare system to provide services to rural and remote areas that weren't getting the medical services that they needed. So by the 1970s, the NP role increased so that there was more educational programs so that we could be trained. And they really found that nurse practitioners were a very important part of a healthcare system. So we're also educators and researchers who are consulted by other healthcare team members. It's really important to remember that in medicine, not one person can know everything. So we are part of a team and we act as consultants. Sometimes we have more expertise or experience in a certain area than somebody else. And it's really important to be able to work as a team when addressing any patient's concern. So a little bit about me. Oftentimes we can see people's educational status based on that very first line there, Joy Beidel, RN, NP, MN, BSCN. And it's just a lot of letters behind your name. My dad is very proud of this, but he doesn't know a single what one of those letters means. So I just want to explain that a little bit. So first and foremost, I became a registered nurse. And then after that was a nurse practitioner. But when it comes to an academic standpoint, when you're listing your credentials, you actually list your most recent level of education. So my most recent would be my master's in nursing, and then followed by my Bachelor of Science in Nursing. So these are all the jobs or all the hats that I currently wear. I am not only one thing or one profession, and I have had the absolute privilege to be able to explore this career of nursing in many different areas of nursing and all over Saskatchewan. So as a nurse practitioner, a clinical nurse specialist, a nursing consultant, and a post-secondary education or educator, which means I am actually a teacher at the university level for nursing students. So I've been practicing as a nurse for 14 years now. And as such, I've had a lot of great opportunities to have a lot of different practice areas. As a nurse practitioner, I currently work for the Saskatchewan Health Authority with the Regina Chronic Pain Clinic and Meadow Primary Health Care Clinic. I had the privilege to be able to help develop the Meadow Primary Health Care Clinic from the ground up. It was the very first primary health care clinic that opened up in Saskatchewan that was health region led. So a lot of primary healthcare clinics, or if you could maybe think of them as general practice, so family doctors, a lot of them are privately owned and not run by the health authority. So Meadow Primary Healthcare was a great opportunity for everybody to learn what went into establishing a practice. And it started with an empty building. I got to be involved with how the rooms were designed, how the client flow would go, the equipment that was ordered, the training of all the professionals that would come through that building, what kind of clientele we would see, what kind of services we would offer. And it was a really great learning curve that I've taken with me in my career to be able to add value to all the teams that I have worked on. With the Meadow Primary Healthcare Clinic that's situated in Regina, I've also been able to work in their rural clinics in Southie Cupar and Regina Beach. And that is a completely different scene because it is rural communities and different sites altogether, but just amazing for the nurse practitioner scope of practice. As a clinical nurse specialist in mental health, I work for Indigenous Services Canada, which was formerly Health Canada, in the First Nations and Inuit Health Branch. And what I do as a clinical nurse specialist is I support all First Nations across Saskatchewan in the mental health field. I support the nurses that work with First Nations. I support the communities. I support other agencies that work with First Nations. So it's a very broad range of people that I get to work with every single day in the mental health field. As a nursing consultant, I am actually trained and certified to deliver mental health training programs such as mental health first aid, Safe Talk, applied suicide intervention skill training, and edutherapy. And those are all mental health focused and directed towards individuals that are looking to help those who are experiencing mental health issues or crisis. As a post-secondary educator, I've been able to be a clinical educator or take students, right into a clinical setting and help to teach them how to be nurses and what it means to, really try the role on in a clinical setting. And so it's been quite a privilege to learn from them and to work in that role as well. So my education, I am a Saskatchewan girl, born and raised. I am a small town girl. I went to high school out in Balgony at Greenall. And I have to say that in making the decisions to what you're going to do with the rest of your life after high school, I was faced with a lot of challenges because I just didn't know. And it's hard to make that choice at 16, 17 years old, what you want to be. But I had to reflect back on the things that I enjoyed in school. And one of those experiences that shaped me and actually encouraged me to go into nursing was that in my grade 5-6 class, I was given the opportunity to see a dissection of a calf that had passed away through the winter. And that had just absolutely ignited a fire in me for this desire to learn medicine, to learn about biology and medicine and how you could help people and how the body really works. So it started early on for me, but I still wasn't quite sure that nursing was the route I wanted to go. I applied into the University of Saskatchewan program at that time was done in Regina, but it was through the U of S. And I was able to finish my Bachelor of Science degree in nursing, and that was a 4-year degree program. I practiced for a little while as a nurse in the cardiac area in Regina. And after 3 years of practice, I decided that I wanted to get my master's degree, and I wasn't quite sure as to why I wanted my master's degree. I just knew that it would help me in my career later on if I wanted to, say, teach at a university level or get some higher up jobs that required a master's degree. So when I applied to the University of Saskatchewan for a master's degree, which at the time was the only program in Saskatchewan offering a master's in nursing, the nurse practitioner option came into play. And I honestly can tell you, I didn't really know what that meant, but I thought, oh, nurse practitioner, I think I would like that. So that's how I entered into the nurse practitioner program. And as I got into the program, I really realized this is exactly what I wanted to do and who I wanted to be. So that was a 2-year degree that I completed. After that, when I practiced as a nurse practitioner for a while, I was able to get a job as a clinical nurse specialist, and was able to get extra training in a counseling diploma and certified instructor in mental health first aid through the Mental Health Commission of Canada. Safe Talk and Assist is through LivingWorks, and EduTherapy is its own entity, and that's about grief resolution and counseling. And I'm currently continuing education in pain management to be able to increase my scope of practice in that field. Nurse practitioners have not always been allowed to prescribe pain medications, the opioid pain medications to be specific. And that change in the practice has just come recently. Our scope of practice is continually changing and expanding to meet healthcare needs. So as practitioners, we get to learn as we go. It's an ongoing process. So if you have ever spoken to a nurse before, you'll find out that every nurse has a different story and educational background based on what their areas of interest are. But most of us start out as registered nurses, so a 4-year nursing degree, and then continue on with our education in whatever fields of study we want to pursue. But it's always important to remember that education is ongoing. I know I've listened or I've spoken with a lot of people that say, oh, I'm just not a school person, or I don't really want to go back to school. But education is a lifelong task, actually, and we learn from everything that we do. So we learn from our work environments, from our colleagues, from our patients, and of course, evidence-based practice that's always changing. So this is something that I really, really wish that I would have known more about in high school. So what do you actually need to be able to be a nurse practitioner? Well, we've got to start with the basics. So in high school, what do you need to apply into nursing? So it's your English. This is based on the U of S website, and the only reason I did U of S is because that's what I know. But the different nursing programs are pretty similar, and you could go to their web pages to find out exactly what their requirements are. But essentially, English A, B 30, Biology 30, Chemistry 30, and then your foundations Math 30. So when I went to school, it was A, B, and C. And now there's pre-calculus in there. So I think things have changed just a little bit, but your highest levels of science, English, and math is what you need. So admission averages will depend on the institute that you're applying to, and then there's pre-professional courses to be taken. So lots of programs now are asking you to take 1 year of university that is just generalized classes, and then to apply into the nursing programs. So the College of Nursing Bachelor of Science degree is through the U of S here that I'm quoting sort of thing, is a competitive entry program, and it's based on your percentages that you have in your first year of university classes. So this is just a little breakdown here of what it is to be accepted into that competitive program. Your average does count. There's a situational judgment test, and the completion of all other admission requirements. And if you wanted to know more about them, you can definitely go to their webpage to see that. So these are the things that you would need in high school to be able to apply into just the registered nurses program. And you need that before you can get a master's program. So the Bachelor of Science in Nursing is a 4-year degree. Excuse me, sorry. And it includes that first year of university, so that pre-professional year. And then if you would like to go into nursing after that, you apply. and you can complete years 2, 3, and 4 in the nursing program, which has your nursing classes, your clinical components, and that's really where you learn to be a nurse. And a breakdown of those classes can be found at this link here, just in case you want to know more about what does that 4-year degree actually look like. So then on to the master's degree. So after I practiced for 3 years, I decided to apply into the master's degree, and I didn't really know what that was going to look like for me. So the College of Nursing, this is the U of S, provides primary healthcare nurse practitioner programs, and there's 2 different admission options for this. So you can get a master's in nursing for the primary healthcare nurse practitioner, which is exactly what I did, or you can do a postgraduate degree specialization certificate in the primary healthcare nurse practitioner. And what that means is some people have already done their master's degree, and they can go on and complete a certificate as a nurse practitioner to become a nurse practitioner. So my degree was a 2 years master's degree program, which included courses and clinical components. And then after that, it's important to know that even if you've passed your master's degree, you still have to complete a license exam to be able to, and pass it to be able to hold an NP license and practice in Saskatchewan. So admissions requirements in your bachelor's degree. So your nursing degree, you need to have a specific average, and you need to have specific classes like physical assessment and pharmacology and statistics and research. You need to be licensed as a nurse in Canada, and you need to have 3,600 hours of clinical practice as a registered nurse in the last 5 years. It's important to kind of know these things a little bit before applying into the nursing program or the master's program, because when I applied, you were just told you needed to have 5 years of nursing experience. I applied after 3 years and I got into the program. So it was a little bit of a muddy water situation. So I'm glad that they've outlined now that you need to have specific hours before you are able to apply into the program. And those hours and that time frame just gives you the wealth of knowledge that you need to be able to go on to the master's degree and complete it successfully. You need to hold a CPR certificate in a healthcare provider level, and then have language proficiency requirements. So I really liked this poster and infographic. It's from the Canadian Nurses Association, just describing why nurse practitioners are an untapped resource, or who we really are. I'm sure you all can read this yourselves as well, but nurse practitioners improve timely access to high quality, cost-effective healthcare in a broad range of healthcare models throughout their practice in collaboration with other healthcare providers. NPs are not meant to replace physicians or replace any healthcare professional. We are an additive bonus that helps to tie that team together, to work together, so that the patient gets the best care that they possibly can. Our education is a minimum of 6 years academic training. When I was looking into the NP program, I was also considering medicine. And it was a little bit daunting to me that I would have to complete another 4-year medical degree plus residency, which would be at a minimum another 6 years. Once getting into education programs, you realize that that time flies, but the nurse practitioner was a great option for me to be able to practice as an independent healthcare practitioner, prescribe, see patients, and do it from a nursing model, which I really, really like. So we're able to do things like perform physical exams, order tests, diagnose and treat illnesses. We write prescriptions. We can admit and discharge from certain hospitals. We provide referrals. We can do the majority of things that family doctors can. There is limitations to our scope of practice for sure. We are not equal or the same. We practice and do things in different ways, but all of them are just with the focus of a patient's health in mind. So the impact that we've had is a 20% reduction in emergency department visits and admissions. We can see patients faster because there's more practitioners available. And there's a lot of other benefits, but along in that map there, you can see across Canada, there is a wide variety of nurse practitioners that are practicing in each province. So in a 2018 survey, that's the most recent data I have, I'm sorry, there was 300,669 registered nurses, and that was a growth of 1.1% from the previous year. And at that time, 6,159 nurse practitioners. And that was a growth of 8.1% in the last year. That's the largest increase in nursing designations. And it speaks volumes to the need for nurse practitioners across all of Canada. NPs have the highest growth rate of all nurses every year for the past 5 years, from 2015 to 2019. And in 2019, there was 267 NPs practicing in Saskatchewan. When I convocated in 2013, there was just over 100 nurse practitioners in Saskatchewan. So it's really nice to see that our numbers are increasing and we're being utilized more in a healthcare environment. Patients will say that it is a different experience to see an NP, that they feel listened to, and that they still have all of their concerns addressed, and they get referrals, and they have more people involved in their healthcare team, which they seem to like. And I personally like as well, because I do believe that it does take a whole team and a wealth of knowledge to be able to care for any one person. So approach to care. Oftentimes I hear, so you're just like a family doctor. Yes and no, we are different. We both provide primary health care for patients. Yes, absolutely. But we come at it from different approaches. So we may see the same patient and come up with the same diagnosis, but we're going to do it in a little bit of a different manner. So we call that the nursing model versus the medical model. So a nursing model focuses on a patient and its psychosocial factors as a whole. So remember how I said previously, holistic health, looking at that person for multiple components, not just the physical ailments they come in with. So this holistic approach doesn't just focus on the disease process and diagnosis, but also on the mental, physical, and emotional aspects. I can give you one example of this. So I've had patients come in, an entire family that have had breathing issues. And, you know, every kid seems to have asthma, and they keep having all these infections, and everything has to do with respiratory. And we've looked at it numerous times and we've treated it, but it still continues to happen. So then we are talking about the home situation. Is there, you know, are the parents smoking, or is what's going on? And it actually came down to, they were renting a place that had mold in it. So everybody was getting sick from the mold. And when we were able to discover that, so it wasn't just their physical concern that needed to be addressed, it was their home situation. We were able to advocate for them to the Rentalsman Board, and the mold was cleaned and everybody's health was restored. So it's just a different approach. Whereas the medical model of healthcare definition focuses more on evidence-based practice and the disease process, pathophysiology, and treatment. So they focus more on what is causing the problem from a disease or medicine-based focus. The model focuses on medical education and practice, leading to patient care and treatment. So basically, the medical model is disease cause is established, the effect is determined, and the treatment is proposed. So medical model and nursing model both have substantial similarities to them, but there's differences in the scope of practice and especially in the patient care approach. And oftentimes I find that the people that have never experienced a visit with a nurse practitioner can, after one visit, tell you that there is a difference in the approach. And like I said, our scope of practice is different, and there's some limitations to it. So previously we weren't able to prescribe opioid medications for pain, which can be a barrier sometimes. So we would have to make a referral to someone who could prescribe those medications. In certain tests, I can't jump ahead and order an MRI. I have to order the X-ray, the ultrasound that states I need an MRI. So there's different things that we have to do to be able to get to the same point, but that's okay too. It's a journey, and when you communicate those clearly, a patient usually feels involved and in control of their health care. So duties, what do we do? This is a hard one to talk about because it depends on where you work. So nurse practitioners in primary health care. So let's just look at that as your family practice. We work autonomously and collaboratively. So that means we work both on our own. I don't need a doctor to do an assessment or to sign off on what I'm doing. I can do that on my own. And we do that in primary healthcare settings. So that can be clinics, that can be nursing stations. So we initiate treatments, we diagnose diseases, we do our physical exams. We have a good knowledge of disorders and conditions, prescribe medications. We order lab tests, x-rays, and other diagnostic tests to help us to determine and to support our diagnosis. But we have to do those within our scope of practice and the standards that were our regulatory standards. We are able to provide comprehensive care within a collaborative team. So we provide a wide range of direct clinical services to people in every stage of life. In addition to treating illness, we teach individuals and their families about healthy living, preventing disease, and managing illness. We bring together medical knowledge with the values and skills of nursing. And NPs are also leaders, consultants, researchers who incorporate new knowledge into their practice. In my specific practice, I have seen a lot of women and children, and it's just probably coincidence of where I work and the availability of healthcare practitioners. But I see a lot of women's health, a lot of childhood illness, but I do practice from all age categories, and I'm able to address all concerns. I have specific training in skills like IUD insertions that maybe not all nurse practitioners or physicians have. And I feel very comfortable in doing that. So I get referrals to do those procedures. I can do things like biopsies of moles or skin care problems and send them off. I can do suturing and minor procedures. So there's the sky's the limit sort of thing, but you still have to know what your standards of practice are and practice within those realms and be safe. So NPs work with rather than replace other healthcare providers. They're part of a collaborative team that includes registered nurses, doctors, social workers, and many other. A typical day in primary healthcare for a nurse practitioner, for me at Meadow Primary Healthcare, was a 10-hour shift. So I would manage a caseload of patients that have seen me previously and that are going to see me in that day. So that means I would be checking tasks and blood work and following up with patients in their treatment plans. I'd be seeing acute health concerns that would come through the door. Let's just say a strep throat and an earache, a toothache, a pregnant woman, and then somebody cut open their toe, so I got to do some suturing. So there was a wide variety of things that I could experience in a day. But each of those I address in a holistic manner, and I'm able to have a little bit of say in the amount of time that I spend with patients. Oftentimes our visits are 30 minutes, but I'm able to expand that to a 60-minute process if I need to, depending on what that patient's need is. I don't have to just suture up a patient in 10 minutes and send them out the door. I do have that 30-minute allotment, and if I need more time, things can be adjusted so that I can really take care of that person. Equipment and spaces that I've worked in. It depends on where I am, but NPs can work in a variety of healthcare settings. So community care, that's community clinics, healthcare centers, physician's office, or a patient's home. We've done home care visits where I'm doing all the things that you do in a doctor's office at somebody's kitchen table or at their bedside. So you have to be able to adapt to your practice. Long-term care homes or nursing homes, hospitals, outpatient clinics, emergency rooms, and other patient areas. and NP-led clinics. The hospitals or nursing stations that I've worked in have been rather amazing. You have a lot of equipment and resources available to you, but the whole emergency room atmosphere is quick, and you have to be on your game, and you have to know exactly what you're doing. And it's exciting and stressful and wonderful. And I always say to people that it is an honor to be a nurse and to be able to meet people in their lives where they need help. Nurse practitioners work in many different settings, and their duties will be dependent on their patient demographic and workplace environment. So my personal experiences, I've been in a variety of settings. I've worked in both urban, so in the city, and rural primary healthcare clinics. I've done rural hospitals. I've practiced in remote and northern nursing stations. I've done disaster relief sites. I'm not sure if anyone remembers, there was wildfires up north a few years back, and people were being evacuated from the communities and brought down to Regina and Saskatoon and the bigger cities. I was able to be involved in that, and that was starting from scratch, and it was super, super exciting and fun and fast-paced. But for the people that were experiencing that, it was stressful, and it was hard, and it was heartbreaking. So I had the opportunity to not only address their medical concerns, but to address those psychosocial issues as well, and provide them some comfort and some relief until we could get them back home. There's travel nursing, and there's a specialized pain management clinic. The really cool thing about nursing is that it can pretty much be done anywhere in the world. Well, not pretty much, it can be done anywhere in the world, and with the right licensing and steps. So I was able to travel to Australia and practice in Australia with the right license, and it was just a really cool opportunity to be able to do those things. So nursing, it provides you with many, many opportunities. The benefits of being a nurse practitioner. Well, NPs bring value to Canadians in our healthcare system, and studies about these benefits and patients' experiences tell us that NPs involve patients in their decisions about their care. So the way I look at that is, when you come to me with a concern, it's not me that has to experience that, it's you. So you get to be in the driver's seat, and I'm going to present you with some options that I think will help you, but you get to choose those. And as a practitioner, I want to do the best by you, but I also can't make those choices for you. So that education part of it, and giving someone power and control over their own lives, is a huge aspect of my job. Improving access to primary health care. Oftentimes I've asked people, how long does it take you to get into your family doctor? It can be weeks, it can be months. With more practitioners available, people are able to access it more readily, and be able to address their concerns right when they're happening. Reduce the pressure on the healthcare system. We've seen significant improvements in ER admissions, or even people just seeking ER treatment, because they're able to access primary healthcare practitioners in a timely manner. We're valued and trusted by patients. Being able to spend the time to really listen to somebody and give them choices in their healthcare allows them to establish that trusting relationship and know that they have value and knowledge. They are the experts in themselves. So I think that that's a really unique standpoint that nurse practitioners take. We provide high quality management of chronic disease. Really educating people about what is going on with the disease process, and what the treatment regimes are going to help them, and how they can help themselves to improve their health and to feel the best that they possibly can. So challenges and stressors. We have many of those in any career that you choose. And I don't like to harp on them because I am a true advocate for the nursing profession, but there are some that do stand in your way a little bit. And if you're a resourceful person, and I think a lot of nurse practitioners are, then you try to find ways to overcome these. So as challenges, role clarification. Sometimes a patient doesn't even know what a nurse practitioner is. So when you walk into a room, they say things like, oh, you're just a nurse? I don't want to see the nurse, I want to see the doctor. And so you have to be able to not be insulted by that and educate the public on what it is that you can do for them and how you can help them. Also, that happens across the healthcare professions. So I've had doctors not accept my referrals because it's coming from just a nurse. And sometimes we need to have our professional associations come in those situations to educate and to let the practitioners know that no, we are a part of that healthcare team and they can accept referrals from us. Resources. Sorry, excuse me. This is the biggest challenge for anybody in healthcare, is there's never enough resources. We have wonderful resources out there, but it's not always accessible. Sometimes there has to be significant travel involved. Sometimes people don't have the ability to access resources. Sometimes there's long wait lists, and that can be very challenging and discouraging for people. But to be able to be a part of helping to create solutions and, you know, get people encouraged and create some hope, that's one of the privileges of our job. Collaboration. So like I said previously, not everybody wants to work with a nurse practitioner. And I think that just stems from a lack of knowledge as to what we do and how we can contribute to the team. We don't want to take over. We don't want to replace physicians. We want to work alongside so that the patient has a lot of different minds and hearts working on their healthcare concerns and treating them as a team. Sometimes we have limitations in our scope of practice. So like I said previously, not being able to prescribe pain medications was a barrier to practice. And so it was brought forth to our regulatory body, and they started working at improving that situation for us. So sometimes limitations in the scope of practice is frustrating for both the patient and the practitioner, but being able to communicate those clearly helps alleviate that process. Stressors. Lack of resources, like I said previously, if I refer someone into mental health services, but it takes a year for them to get help, that's really, really hard for both the patient and the professional because they need help right now. Lack of professional support. So getting counselors out to patients or having access to, some people don't have phones, some people don't have internet. So how are we able to get them to the supports that they need? Some people don't have the money or transportation to get to an appointment. So those things can be an issue as well. Sometimes navigating unique healthcare concerns and providing comprehensive care to address those is stressful because it's not a one size fits all. And like I said previously, every patient has the right to choose what is right for them and which road they want to go down. So sometimes trying to navigate the right way for them can be difficult and challenging and a little bit stressful. And then job availability as a nurse practitioner that's close to home. There are jobs available, but they're not necessarily in the city with the right hours. Sometimes it takes travel. Sometimes it's up north. But if you're willing to go up north to these places, you can really experience a wonderful setting and get some really good experience. I've been very lucky in my career that I've been able to find jobs close to home and be involved in the programs that I have been, but that's not the same story of all nurse practitioners. But as the healthcare needs increase, there are more jobs that are available for nurse practitioners. Salary and benefits. Lots of people want to know this. How much money do you make? So the Saskatchewan Union of Nurses represents nursing professions as a whole and for bargaining terms and conditions of employment for their members. And once those terms are in place, they assist nurses in enforcing these conditions. The terms and conditions are related to things like salaries, shift differentials, hours of work, holidays, sick times, leaves, and other important employment issues. This is the one thing that when speaking to doctors that they wish they had, because they are self-employed And they don't have, if they didn't write this into their contracts, they don't have these things in place automatically. And nurses, our union has fought for us to have these things in place. So oftentimes nurses, we don't even know the fight that went into that, and that the benefits that these actually are. So salary ranges based on that Saskatchewan Union of Nurses collective agreement is anywhere from $49.56 an hour to $62.90 an hour. And that approximately works out to about $80,000 up to $125,000 a year. And this is based on years of experience and where you are in that stepped ladder approach for salary. Benefits are different based on different employers, and they're offered through different programs and private coverage. So generally benefits include a broad range of medical coverage and dental. Pension, so for the Saskatchewan Health Authority, I'm covered through the Saskatchewan Health Employees Pension Plan, and it's jointly sponsored from you put money into it, and so does your employer for retirement security. And oftentimes when you enter a career, you're not necessarily thinking about your retirement, but it's a very important thing to have investments in, so that later on in life, it's there for you when you are ready to retire. Vacation hours are earned, and they're based on the years of employment and the hours that the employee works, and it's all outlined in that SUN collective agreement. And like I said previously, physicians that I've spoken to don't have healthcare plans or benefits, and they don't have sick days or vacation days. So it's a benefit to be able to have these, and that our union has really fought hard for us. Our work hours vary depending on the area we work in. NPs are generally working business hours during the day. However, that's not the case for all NPs, and the hours are set by your employer, and they can be shift work. So it's important to know what the expectations are of the place that you're being employed in. With the Meadow Primary Healthcare Clinic, I work 10-hour shifts. With the Chronic Pain Clinic, I work 8-hour shifts, and those are daytime hours. But the Meadow Primary Healthcare Clinic is open 7 days a week, so I do have to work weekends sometimes. So the Saskatchewan Registered Nurses Association is something that's important to touch on for all nurses, because it's our regulatory body. This is how we get our license, and this is how we stay accountable. So the Saskatchewan Registered Nurses Association is accountable for public protection by ensuring its members are competent through means of including initial and ongoing licensure requirements, practice standards, practice advice and support, approval of nursing programs, continuing competence requirements, and competence assurance mechanisms. So this is important because this is how we ensure that people are, or nurses are, practicing safely. And that's how you hold a license, and that if any concerns are brought forth about practice, this is where it goes to. And they're accountable for public protection by ensuring that their members are accountable, they're competent, and they promote a personal interest in its members and public interest. The continuing competency program is mandatory, and it's ongoing education program that ensures that all RNs and NPs are continually enhancing their practice. So it's self-directed, which means you have to do it yourself, and that you have to provide proof that you're doing it every single year to keep your skills and your nursing knowledge relevant and safe in practice. To maintain eligibility for registration, so to have your nursing license, you have to work a certain amount of hours in a 5-year period. This was important, and nobody ever discussed this with me. I wish that this had been told to me before. So as an RN, you need to work 1,125 hours in a 5-year period to be able to keep your license. That is not full-time at all. And that's a long period of time to get those hours in. So if somebody decides to go on a maternity leave or do some traveling or take a job elsewhere, they can still maintain their nursing license without fear of it going away and you having to do extra education to get it back. As a nurse practitioner, that timeline shortens significantly. So to maintain eligibility for registration as a nurse practitioner, you need to practice a total of 900 hours in a 3-year period, and 600 of those hours have to be clinical practice. And what that means for nurse practitioners such as myself is that it can be a little bit of a scary process if you were to go on a leave, such as myself, a maternity leave, and have 1 full year that you have no practice hours. You can be at risk of losing your license. Or if a family member falls ill, or you need to do childcare for X amount of years, 900 hours in 3 years is significantly more than what the requirements are to keep your license as an RN. So I wish that I had known that before going in, and it wouldn't have changed my direction at all, but it would have just given me a little bit more knowledge of what the requirements would be of me in this career. So our union, the people that fight for our rights, so they work as a single discipline, which means the registered nurse. And that doesn't, they fight for the nurse practitioner, but we are all considered registered nurses. And they work for both preventative and treatment settings. We work alone and in teams. And we have to practice within the accordance of the Saskatchewan Registered Nurses Association, or the Registered Psychiatric Nurses Association of Saskatchewan. And it is the goal to achieve safe and healthy practice for all SUN members. What I like about having a union is that you always have somebody to go to when you're unsure about an employment situation. And when you need clarification, you always have someone on your side to support you. So they bargain terms and conditions of our employment, and they assist us in enforcing those. So things like overtime for beyond a 12-hour shift or beyond a 40-hour work week. They've set forth all of the guidelines as to what our rate of pay is, and how we need to have time off in between. So all of these things are really awesome things to have within a union. They're affiliated with the Canadian Federation of Nurses Unions and the Canadian Labour Congress, also Saskatchewan Federation of Labour. So lots of involvement with different associations. The professional associations that I have the most involvement with is the SRNA, which is my licensing and regulatory body, the Saskatchewan Union of Nurses, Saskatchewan Association of Nurse Practitioners, and the Canadian Nurses Association. The wonderful thing about professional associations is that they provide you with support and guidance and educational opportunities for NPs, so that they can come together and help to support one another, and advocate for the continual increase and evolvement of our practice. Opportunities in the field. So the nurse practitioner career, the role in general has always evolved. In the time that I've been a nurse practitioner, things and guidelines and scope of practice have changed so significantly, and it's our job to stay on top of that and to train ourselves in the specific programs we need to be able to stay relevant in our career. And as these needs arise in the healthcare system, we'll see that the nurse practitioner field itself is going to expand even more, because there's a need for it, and there's been proven studies that nurse practitioners do make an impact, and they do wonderful things for patients and a healthcare system. There's always room for advancement in the nurse practitioner career, and it's achieved through education and training. So I've talked previously to other people in the nursing field, and they seem to think that the NP is as high as you can go. So that's the ladder you've climbed, and that's as far as you can go in nursing. But it depends on really what you want to do with your career and who you want to be, because you can go on and continue your education and get a PhD, and that's an academic doctorate. You can actually go on and do other degrees as well. You can be a specialist in different fields. But so there's always an opportunity to increase your knowledge and an opportunity to specialize, which I've really, really enjoyed in my practice. When I first became a nurse, I was really scared of mental health, and I didn't want to be involved in mental health at all. And now, as my career has evolved, that's my specialty. And I realize now that I didn't want to be involved in it because I was scared of it, because I didn't have a good knowledge. And the more educated I became, the more passionate I became about mental health and being able to advocate for those who are experiencing troubles with their mental health. The other area I really didn't want to have anything to do with as a nurse practitioner was prescribing opioid medications or pain management. And now I'm working in the pain management clinic because I've seen that there's a need for it, and that nurse practitioners can make a significant impact in people's lives, in their education and in their control over their own health, that it was something that I really wanted to be involved in. So a lot of my hesitations came from fear and lack of knowledge, but as an NP, I've been provided these opportunities to advance my career. The nursing roles are expanding and evolving to address healthcare needs. And so we will see that we're able to practice in more areas and be able to touch people's lives in more ways. So some of the NP roles that I've experienced or had colleagues in are the primary healthcare role, so family all ages, or just a pediatric or geriatric practitioner. There's neonatal nurse practitioners, and I've had some experience with that myself, as my firstborn was in neonatal and taken care of by nurse practitioners. You can be a nurse midwife or an anesthetist. So in the nursing field, the availability to increase your scope of practice and your training is vast. Work-life balance. I think a lot of people have issues with this because it's hard. You want to do the best you can and be dedicated and passionate towards your career, but you still need to have a balance. So in general, we have 40-hour work weeks, which can be any day of the week, which includes weekends, and our work and our personal life have to be adjusted to suit these hours. So I don't know if anybody knows anybody that's worked shift work before. Sometimes our daytime is your nighttime and our nighttime is your daytime when you work shift. And you have to be able to adjust to adapt to that. Work environment set the hours. So some NPs will work 8 hours, 10 hours, and 12-hour shifts, depending on their work environment. But anything beyond a 12-hour shift or a 40-hour work week is considered overtime, and your rate of pay will change accordingly. Time off is outlined in our collective agreement, ensuring that employees have a balance between the hours that they work and the hours of rest in between shifts. This also is a safety measure for people so that you're not working 24, 36, 72 hours in a row. And you need to have time off for the safety of yourself and safety of the patients. Holidays. So holidays are earned and they must be requested by the NP and approved by management. And approval of these is not always granted because it's based on what the demands of the practice are. So if a facility is open 24 hours a day, 7 days a week, they need the staff to be able to cover that. And it's not that you can't take holidays, it's that you have to take holidays maybe when other people aren't. So that's at a management level that they decide whether or not your holidays will be approved. And overtime is earned on time worked above and beyond normal working hours. The rate of pay changes and increases. So if I'm working as a nurse practitioner with the health region, as soon as I go into overtime, it's double time. And with other employers, it's a different rate. Sometimes it's time and a half, but it depends on the employer. And those guidelines are set out by our unions and our collective agreements to ensure safety. And that is kind of the nuts and bolts of what a nurse practitioner does and who we are. And I'm not sure if anyone's aware of it, but it is Nursing Week here. And so I really do want to encourage anybody that is interested in the nursing field to look into it, to get into it. It's a rewarding and wonderful career to be able to be involved in. And I open up the mic now to anybody that has any questions. And thank you very much for having me here today.
Thanks, Joy. That was very thorough. I had quite a few questions, but they were all answered. So that's awesome. Anybody else have any?
Yeah, Kevin here from Sun West. I live in Rosetown, an area here, Joy. I've often thought here with, nurse practitioners that kind of could be really a part of the team in rural areas. And yet I don't see many nurse practitioners in our rural areas yet. Maybe it's something that's, going to evolve over time, because it's sure we have a difficult time in rural areas, not just our area, but so many rural areas, recruiting and retaining doctors. Sometimes, maybe if we could get more nurse practitioners in our rural areas, I just think the job could just take off even more yet as an occupation. Is there any statistics on that?
Well, it absolutely could and can. Oftentimes, like I had said previously, the nurse practitioner role started in rural and remote communities. So essentially, how it all starts is with community members being able to approach their healthcare authority. So previously, within Saskatchewan, we had different health authorities, right? Like we were the Regina Health Region, there was Sunrise, there was a whole bunch, but now we're all one health authority. And if you could advocate to your MLAs that, we're having physician shortages, we're having a hard time recruiting and retaining, is there clinics available for nurse practitioners to work in, or facilities? Could there potentially be pilot projects that could be funded through your Saskatchewan Health Authority? And it takes a community coming forward to be able to advocate for that. So I can give you a strong example of that. The rural clinics that I've worked in Southie, Cupar, and Regina Beach were completely and utterly community driven. They were having a hard time finding physicians to come out to these places, and the unpredictability of the primary health care services that were being provided had them being creative and coming forth to the health region to say, we need something more and we want to be more proactive. And so they actually created an NP role. And since then, they've actually developed, so they had facilities for them to work in, but because the role has expanded so much and the communities are so dependent on it, every one of those communities has actually established brand new clinics for NPs to work in.
Okay, that's good to know. Because our community did recently build their own clinic for a couple of the doctors. I don't know how many more people they could accommodate. I'm sure they could accommodate more, but yeah, that's something for us to consider in our community, in lots of rural communities, because I think that could go a long ways to providing more care.
Absolutely. And the thing to remember is currently, like I said, how the nurse practitioner scope of practice and role is expanding. So currently we cannot bill privately the same way that a physician can. So they bill through the medical services branch and they get paid per visit and for tasks that they do. Nurse practitioners don't have billing codes. So they actually have to be employed through a health region or through a specific employer that's willing to work with unions and willing to, follow the guidelines. That is the employment of a nurse practitioner. But I have seen pilot projects that have happened with specialists. So a nephrologist in the city hired a nurse practitioner out of his own pocket, and he was able to decrease his wait times from 1.5 years down to 3 months.
Yeah, that's impressive.
From one nurse practitioner being able to come in and help manage care. So creativity is pretty much the name of the game when it comes to getting practitioners into your communities, but you have to start by showing the need and the desire to have them.
Okay, thank you.
Thanks, Joy. Yeah, what an awesome presentation. Thank you so much for sharing all this wealth of information. I have a question in regards to a student potentially looking into nursing as a career. For the prospect of a job, what is more employable right now, a registered nurse or a nurse practitioner? In your mind, I mean, I know that, I guess I'm not quite sure, just to, for students or counselors guiding students into the profession. What would you say for that?
Well, your starting point, no matter what, is a nurse, registered nurse, right? So to be able to go beyond the registered nurse to the NP is another 2 years. It's practice hours as a registered nurse as well. There are way more jobs and significantly more, like 8,000 nurses, registered nurses in Saskatchewan versus the 267 NPs. So employability as a registered nurse, there's a lot more jobs out there, and there's a lot more areas that you can work in. But that's a great stepping stone to be able to gain the nursing knowledge and practice knowledge that you need to be able to go into the nurse practitioner field. So for myself, I was trying to evaluate whether I wanted to go into medicine. And I knew I wanted to be more of an advanced practitioner than the registered nurse level. So the NP option was a great option for me to be able to increase my scope of practice. But there is definitely way more jobs as a registered nurse. But I would never ever discourage someone from going into the NP field. But you do have to understand that the jobs are significantly less. And the same is to be said for doctors. So when they come out of school, they have their medical degree and they have to complete a residency. There's way more jobs for family doctors across Canada than there is for obstetricians or nephrologists or specialty careers in medicine. So it's something to just to take into consideration. But no matter what your passion is, there's a field of work for you.
Yeah, and I guess that's how you answered the question in regards to students potentially looking into expanding their career as a nurse practitioner. Just like you said, in your case, you were wanting, potentially looking into medicine. So this was that next, interim type of, step that you could do to see. So thank you for sharing that.
Yeah.
One more question I had about COVID. How can we not address the whole COVID situation? How has, thank you to all the nurses that have stepped up for this past year and a half of what we've experienced here as a world, not as just even as a Canadian, but how has your job changed with the whole situation?
So the needs, the demands of my role have not changed. They'll always be there. There will always be somebody who needs help with an acute care illness or a chronic disease. But the added portion of COVID has created a really unique practice environment for all of us. So within the nurse practitioner role, I know that a lot have been deployed or taken out of the primary healthcare setting and being assigned into a COVID specific setting. Not everybody, but some people have been. As my role as a clinical nurse specialist in mental health, our roles have completely shifted to being clinical support or clinical nurses, COVID related. And that's because the need is so high in First Nations that it's all hands on deck. When you're a nurse, you're a nurse. It doesn't matter if you have a master's degree or you're a nurse practitioner, you need to be able to provide that care and those services to the people that need it. So it's significantly impacted all nurses across the province. And it impacts not only our professional lives, but it impacts our home lives as well. And I think that that's one part that often gets left unnoticed, is that the time we take away from our families or that we bring risk back into our homes by being exposed. So it is a blessing and a privilege to be a nurse. And it comes with its own sets of challenges and stressors, and COVID has tested all of us.
Thank you so much for sharing that. Yeah, that's awesome. And yes, thank you so much. We appreciate all the time and effort that's gone into this past year and what has come through the medical profession. So thank you.
No problem.
If there aren't any more questions, we will stop recording. And again, thank you very much, Joy. Fantastic.
Thank you.